Hello, everyone, and welcome. Today, I am joined by Dr. Barbara Yawn. She's the Chief Clinical Officer for the COPD Foundation, and she is here with us today. Spend a little bit of time talking to us about COPD and COVID-19. And so I know that we have done a series of these in the past, but we want to just keep the community up to date as new information comes along and with new things that they need to consider. So Dr. Yawn, first of all, thank you for being here with us this morning.
Well, thank you. It's always good to talk and share information as it becomes available.
Yes, thank you. And you're such a warm presence for us, and you're so reassuring. And I know people enjoy listening to you and hearing what you have to say. This morning, first of all, I wanted to start off with a question that we received that says, are there people who do not need to wear masks or who might be exempted from wearing masks?
Well, in our community, the COPD community, adults usually 40 and older, there really are no safe exemptions. Everybody needs to be wearing a mask. I know that there are people who find it difficult. They feel uncomfortable. It doesn't fit well over their oxygen, for example. But I really encourage those people to try multiple different kinds of masks. They may find that the stiffer ones don't work well with the oxygen, but some of the softer cloth multi-layer masks do work okay with their oxygen. Other people will say, I just find it really feels difficult to breathe. And I do understand that feeling, but that feeling may not translate to really lower oxygen levels in their body. They still may be breathing in adequate amounts of oxygen. In fact, there was a recent publication in the European Respiratory Society Journal, and they looked at oxygen levels in people with COPD wearing masks, even when they were exercising. And it was really quite rare that anyone's oxygen level, using a pulse ox, which many people can do at home, their pulse ox levels just didn't fall. And so this suggests that is more a feeling of discomfort, anxiety. And we all know that anxiety can be dealt with, and sometimes a way to deal with it is to put the mask on when you're at home in a very safe, comfortable environment, and wear it for maybe a minute to start with, move up to 5, 10, 15 minutes. Then when you can do it sitting down comfortably, get up and walk around your house with the mask on and see. If you have a pulse ox that you can use, that can be very reassuring, because if you put the mask on and you walk around and your oxygen saturation or your pulse ox does not go down, you can feel comfortable that this is something you just need to get used to. So the answer is, among adults, there are no people that should not wear masks.
Thank you. And I love those tips that you were giving. You know, wear it for a few minutes at home, you know, adjust. This is a new experience for most people. Healthcare professionals have been wearing masks forever, but the general public, this is something that they have to get used to, and doing it at home when you're comfortable and safe, that's a good time to practice. I've also noticed, just along those lines, that there are some companies out there now that are providing some sort of brackets to put underneath the mask to hold it away from the mouth and the nose. And some of the reports have been that helps that feeling of suffocation. So it doesn't pull it away from the edges of the face, still providing the protection, but it kind of keeps that smothering feeling from happening so much. So that might be something to look into.
Yeah, no, that's a very good idea. And I think that would be, trying that and trying other things. The other thing that I would hope they would do is maybe get on 360 Social from the COPD Foundation and ask other people, have you found a mask that's approved and safe and keeps the seal around the edges, but that's more comfortable. So ask and share, because if somebody finds a kind that works, let's spread the word and let other people know. I mean, that's the beauty of 360 Social, is talking to other people that have what you have and have the same stresses and may have answers that you haven't found yet.
I love it. I think that's perfect. Yes, and collaboration and working together, that's how we learn. Absolutely. So talking a little bit more about the exemptions, the next question here is, what are mask exemptions and should I get one?
Well, there are some states and some countries, although none of us can go to another country right now, but there are some states that have put into their regulations some suggestion that there may be exemptions. Now, there are people with certain facial deformities that really cannot wear a mask, but those, again, are very rare individuals. If you think you need an exemption, please talk to your healthcare professional, your doctor, your nurse, whomever takes care of you regularly, and discuss it with them. I don't mean go in and browbeat them until they give up and say, all right, you get an exemption. But talk to them about it, because it really is problematic. Let me read something to you that's from experts. This is a statement from a collection of experts in respiratory. And they say situations such as chronic lung illnesses without an active exacerbation. Now, when you have an active exacerbation, you ought to probably be staying home anyway. It really is not clear there should be any exemptions. People with a chronic illness are at higher risk for severe disease from severe acute respiratory syndrome, coronavirus 2, that's COVID, another name for it. And they conversely, if they're infected with it, would likely have more problems. So they really need to protect themselves. There is a risk-benefit ratio that must be carefully considered. And I think that's it. That last statement is the risk and benefit. What is the risk of getting a mask exemption? You're at greater risk for exposure. And maybe if you happen to have COVID, you're certainly at greater risk of spreading it if you have a cough. And the benefit, well, what is the benefit? If you've checked and your oxygen levels don't go down and you can figure out how to wear your nasal cannula under the mask, I don't see a benefit. So I don't think anybody should be automatically assuming they need an exemption because they have COPD or other chronic lung diseases, asthma, whatever. Talk to a healthcare professional. And one of the things I really like to remind people is there are companies out there making all kinds of money right now off of COVID scams. And one of those scams, and I went on the internet to look, is you can get for like $10, you can get a plastic little badge that says, I have a mask exemption. These people have no medical background, no basis to say that you should have a mask exemption. So please talk with your healthcare professional. If you then do indeed qualify because of some unusual conditions, then okay, go get one of those. But remember, those sites really have no official standing. They just want your $10 or $15.
That's a good reminder. You know, the scams abound anyway, and especially in situations like this when they know that people are vulnerable. So good to keep our eyes open. Again, following this line of keeping ourselves safe, the question here is, what is it safe to do? And I think what they're getting at here is, you know, things are beginning to open up a little bit. There are groups that are meeting, but what is safe? Can you help us define that a little?
Well, I think safe certainly depends on our age group and our other risks. I mean, I'm obviously in the older age group too, which puts me at increased risk. So I think about these for myself as well as people with COPD. So what is it safe to do now? Has it changed for people with COPD? And my answer is no. I don't think it has changed. Just because in some states you can go to an indoor restaurant, I'm still not comfortable that that is a good place for somebody at high risk to be going because you have to take your mask off to eat. And it's hard to stay 6 feet apart. And, you know, some of the wait staff, for example, are excellent at wearing their mask. I see them wearing it as a chin strap. So, you know, I think you really need to think about things like that. Now, the places that I do think have been pretty safe all along, if you're wearing your masks, are things like grocery stores. And you try to go at a time when it's not really crowded. And those may be harder to find nowadays since people are working from home and have flexibility. But, you know, usually the middle of the day on Wednesday, or maybe 7 o'clock in the morning on Thursday, or whatever it is, grocery stores seem to be a pretty safe place to go. Your healthcare site is usually a safe place to go. In fact, this morning I just went and got my flu shot and watched everybody stay socially distanced. I watched all the precautions they were taking. I felt very comfortable there. How about things like weddings and funerals? I think our best bet at weddings and funerals are still virtual. I've been to several virtual weddings and a couple of funerals too. And family gatherings. I think all of those are still what we should be doing because we're at higher risk. I think any gathering of family that you've been around all the time, they've been quarantining, whatever, you should feel safe in a small family gathering. But you get more than about 5 or 10 people and you're close together, I get uncomfortable.
Yeah, I wanted to make sure we talked about that here on our time together today, because the holidays are coming, you know, and people are wanting to get together with family members and friends. And I just wanted us to have a chance to really talk about that, because as you said, if you get into groups of more than 5 or 10 people, you're not just in contact with those 5 or 10 people, you're in contact with everybody they've been in contact with. And so I think it's just important to remember.
Well, and especially as, you know, we get a more distant family grouping together, you know, your grandchildren may be off at college. And if they're doing in-person college, that's a pretty big group of people to be interacting with. You know, maybe if your children, grandchildren, great-grandchildren are going face-to-face school. Now, I think face-to-face school is a good idea and important for the kids, but it may be a little concern for you if their schools have had problems. So this may be the time to learn to have virtual turkey together. And, you know, I guess everybody has to cook their own turkey and we eat together. But I think that we need to be creative and keep ourselves safe. I don't want people to feel like they have to stay in their house and they can't go anywhere, because there are places outside. And I have to say, as it gets colder, those masks outside feel pretty good. I kind of like keeping my face warm. So outside, in your own area where there are not a lot of people, the grocery store potentially, things like that are safe to consider.
So, Dr. Yawn, I know there were some questions early on, back in the spring, people had questions about whether they should take or continue taking their oral and inhaled steroids. And I know that we've learned a bit more about that now. And so I wonder, what do you say about that question?
I say, please continue taking your inhaled corticosteroids or your oral steroids. There is no evidence that using the inhaled corticosteroids for asthma or COPD increases your risk of getting COVID, or if you unfortunately did get COVID, increases the severity of the COVID. So you need to take them. We have lots of evidence to show that if you need these medications for your COPD or asthma or whatever, and you stop taking them, you are likely to get yourself into problems with your underlying condition, with your COPD. So please take them. And as far as oral steroids, most people take these when they're having a flare-up or an exacerbation. And yes, you need to use them because you need to get over that exacerbation and flare-up with the oral steroids and maybe the antibiotics you're given. And again, there is no evidence that using these will put you at higher risk of getting COVID, or if you got COVID, make it any worse. Take the medication as prescribed, please.
Thank you so much. So let's shift gears a little bit, because people are going to ask this question and have been asking this question. What about a COVID vaccine? Is there a COVID vaccine that's close?
Yeah, well, I guess it depends on your definition of close. I don't think there's going to be a COVID vaccine in the next few weeks. I would be surprised if there's one by the end of the year, but maybe. I think most of the experts that I've listened to have said they think it's going to be sometime next year at the earliest. There are some studies now of vaccines that are in the third phase of study. As you probably know, drugs and vaccines go through 3 phases. The first phase is when we check and give it to a few very healthy people and make sure there's no immediate adverse reactions. Then the phase 2 is you give it to a little bit larger group of people and see what happens. Does it do anything? And in this case, does it help raise the immune response or antibodies to COVID? And that has been finished. And then stage 3 is where you give it to the people that need the vaccine. And the studies right now, some of them, there are about 3, I believe, maybe 4 that are in this phase around the world, a couple of them in the United States. And they are doing it in different age groups. They're doing it in the 18 to 55 and then the 55 and older. There haven't been a lot of results. The very early results that have been released, there was information on the 18 to 55 group, but they had so few people in the 55 and above group they'd studied, they really didn't have enough information yet. And none of them have been studied in children yet. So you can understand that we'd all love to say, yep, it's coming right away. But collecting the data is not instantaneous. It takes time. And we want to make sure that while they do 2 things. 1, they give sufficient protection, and 2, that they're safe, that they don't have any unexpected side effects. And those both take time. Now, the studies on the COVID vaccine are different than what we've done for other previous vaccines. Let's take one of the others that was recently approved, the shingles vaccine. The shingles vaccine, when they studied it, they gave it to thousands of people, and they watched over a period of 1 to 3 years to see if getting the vaccine kept you from getting shingles. Now, that's very different than what we're doing now. What they're doing now is giving the vaccine, and then in a period of a month, 6 weeks, 2 months, 3 months, they are checking blood tests to see if you have made antibodies. That is not the same as saying you haven't gotten the COVID. So people need to understand the difference that's going on with the testing. And I think that is really important. Also, right now, all except one of the vaccines are going to take 2 shots that are 2 weeks to a month apart. And so that's why it takes a little longer to study the vaccine too, because they can't study even the blood test until a while after they've given the second shot. And in the things that are behind the scenes that a lot of people never see at all is some of the requirements right now for these vaccines. One of the vaccines that's fairly far along needs to be stored at -70 degrees. And even if you live in Alaska or Minnesota, that is really, really cold. And that is not easy to keep something at -70 degrees. That doesn't work in any of our offices or any of our pharmacies. We don't have those kind of facilities. The other one that's fairly far along is kept at -20 degrees. And we don't have those kind of storage facilities either. So there are a lot of behind the scenes practical things we have to work out with these vaccines too. How are we going to distribute them safely and effectively, but store them at -70? We're working on it.
Boy, that is a lot. That is a lot of background information that I think the public would be, I'm glad that you shared that with us, because I think we don't understand a lot of the limitations or the obstacles that are trying to be overcome. So thank you for sharing that. That's very informative. But speaking of vaccines, the COVID vaccine that we're all waiting on, it's out there in the future, but we have a vaccine that we'd like to encourage everybody to take now that is out there and available, and it's the flu vaccine. And I'd like for you to take just the last few minutes of our time together today and talk about why is it important for our population to have the flu vaccine, and what's different about the vaccine this year.
Yes, it is absolutely important that everybody get the flu vaccine this year, especially people in high-risk groups like our COPD community and older adults. The flu vaccine, we hear all these things, well, it gave me the flu. There is no data or evidence to show that the flu vaccines, which are not live vaccines, will give you the flu. There is no question that some people get symptoms after they get the flu shot. As I said, I got my flu shot this morning. My arm isn't sore yet, but probably by tonight, my arm's going to be a little bit sore. Some people have more of a reaction, and they can feel tired or achy or even a little feverish. This is not influenza. This is a normal inflammatory response to a vaccine. I know we used to tell our patients when they say, well, my baby's leg got red when they got their baby shots. And my answer was, well, that's really kind of good, because it means the body is reacting to this shot. And when it's reacting, it is making an inflammatory and then an immunological or immune response. And that's what protects us from the flu. So I don't think you should believe or assume you're going to get the flu. You may get some symptoms, but you're not going to get the flu from the shot. The other thing we hear is, it didn't protect me. I still got the flu. Well, make sure first, we're talking about influenza, Flu is not the GI symptoms. There are a lot of people that get what they call the stomach flu. That's not what we're talking about, and that's not what this shot protects against. But there are indeed people who sometimes get influenza, even if they've had a shot. We do, and the scientists do the best they can at predicting the subtypes of flu that are going to be really common that year, because there are a lot of different subtypes. We've all heard about H1N1 and this H2N2 and all kinds of different things. And we have to try to use available information to select the proper types of flu to put in that year's immunization. And it's not always 100% perfect. So you indeed do still have some risk because it doesn't cover everything. But those are uncommon years that happens. And this year we don't know yet, but you need to give yourself the best chance of protecting yourself against multiple types of the influenza. And that's the thing that's changed for those of us that are over 50, is up until this year, we were only able to get a trivalent flu vaccine. It meant trivalent means there were 3 types of the influenza that were covered. Now we have quadrivalent high dose. So now it's expanded to 4. So that is broader protection, and that is great news for those of us over 50. We get the high dose influenza vaccine. That means it has more of the vaccine in each of the doses we get. The high dose, about 4 times as much. And now it covers 4 of the influenza strains instead of 3. And for people who are allergic to eggs and have some concern about that, there is the high dose quadrivalent available in the flu block, which has no relationship to eggs. It wasn't grown in egg embryos or anything like that, and is safe for people who have egg allergies. So the news for those of us over 50 this year is all good with the flu shot. There were some concerns early in September and late August that there were some shortages. Well, they weren't really shortages. It's just they hadn't had time to get all the doses out. And I have not now heard of any place where people are not able to get a flu shot when they went in, either to their doctor or nurse's office or the public health department or one of the large pharmacies.
Thank you, Dr. Yawn. That was another question that I had, was about delays or if there was a shortage. Another question that comes in frequently, and this question comes in on COPD 360 Social a good bit. Is it okay to get the flu shot, a pneumonia shot, or a shingles shot at the same time?
Yeah, that is a great question. And yes, it is. And please do so, because, all of us kind of forget to go in and get up to date on all of our immunizations. So you can get the flu shot and the pneumonia or pneumococcal vaccine at the same time. You may need a second dose of pneumococcal vaccine a month or more, 2 months later, so you should talk to your healthcare professional or the pharmacist about that. But you can get either the first or second dose of the pneumococcal or pneumonia shot at the same time as the flu shot. You can get your shingles shot at the same time as your flu shot, and that would be the first or the second dose of your shingles shot. So yeah, if you're going to go in there, you might as well just let them have both arms, one arm for one and one arm for the other, and get yourself up to date.
Great advice. That is just great advice. Thank you so much, Dr. Yawn. I've really enjoyed our time today. I think this has been a great conversation. I'm hopeful that it's helpful to the community. And I thank you for being here with me today.
Thank you.
And if you have any other questions, please feel free to reach out to copdfoundation.org. We have a blog site that is updated pretty frequently, and we also have the COPD 360 community that is available for you to come and ask questions and join the discussion. Thank you so much, and have a great day.